Dr. Gangansong, first, thank you for mentioning the need for the 5-year reauthorization of the PEPFAR program. That's something that this committee is very much interested in pursuing. We're disappointed we have a short-term extension. We do believe we need the 5 years, so I'm glad to hear you mention that. The position that you've been nominated to, Ambassador at Large for Global Health, Security, and Diplomacy, there will be an interesting relationship that I would like to get your views on. There's a turf issue between the State Department and USAID on health issues. Your responsibility is to the State Department directly. We have the USAID that's engaged also in healthcare issues, and there have been some concern about the mission creep between the two divisions, the full division and USAID. Can you just tell me how you plan to work with USAID so that the turf differences does not at all impact on our ability to be effective in dealing with global health issues?
Thank you, Senator. I want to assure you that it's very clear once the Bureau was launched that what our role will be. We will be leading in 3 key areas. First of all is to, as I said earlier, lead with diplomatic engagement with all global health security issues, related issues. Secondly, to elevate global health security as part of our foreign policy. And lastly, to coordinate our foreign assistance so that it can help advance our international health cooperation and global health security. If you look at the recently launched Global Health Security Strategy that the White House just released, on page 32 of that document, it clearly defines the roles and responsibilities of several agencies. A beautiful document, great strategy. And in there, it outlines 13 functions of what the State Department should be doing in the overall space of global health security. So it's very clear that through the interagency collaboration, constantly engaging with USAID, CDC, HHS, and NIH will be able to leverage more effectively and coordinate our global health security functions.
Of course, one of the areas that will help is burden sharing, to have our allies step up and do more than they currently are doing in this global area. The United States is by far the leader on resources. Senator Coons, who chairs the subcommittee on appropriations that deal with foreign aid, will tell you that he doesn't have enough money. So if we only have a limited dollars available, the competition between monies going into direct programs at USAID or going into your agency are going to be in discussion. How do you assure us that that discussions will be positive and that it will not deter from the working relationship between you and USAID?
Absolutely. Within the new Bureau, the Bureau of Global Health Security and Diplomacy, there's a program side of it, which is the PEPFAR, Chairman, which you alluded to. And that has existed for the past 21 years with clarity of roles and responsibilities. The global health security side of that, the new Bureau, is mainly around policy coordination and diplomacy, leading with diplomacy. I'll give you a good example to substantiate that. Last year in February, if you recall, there was a Marburg outbreak in Equatorial Guinea in Central Africa. None of our agencies were present in that country. The only presence we had was our ambassador. And he played a critical role of engaging with the leadership, the political leadership of that country, to enable us to deploy assets to respond to that threat, which includes CDC deployment, USAID deployment, and WHO. When discussions were tense, where the government of that country said, we don't need any further cooperation, our mission and ambassador was the only person in country that brokered the relationship. So that's the kind of coordination and leveraging that we hope the new Bureau will enable us be more effective in our global health security response.
Thank you. Ms. Hurst, since the civil war in 2009 in Sri Lanka, there's still been an issue of reconciliation and accountability. There's concern about corruption in the country. There's concern in regards to human rights, the Draconian Online Safety Act. is looked at as trying to stifle any dissent in the country. So human rights are going to be front and center in our expectation of our mission in Sri Lanka. Can you assure us that that is going to be a key priority of the mission, and that the U.S. mission will be there to speak out on behalf of those individuals whose voices are being difficult to be heard in the country today?
Senator, thank you very much for your question, and I share your concern and your commitment to human rights. And if I am confirmed, I will put accountability, governance, anti-corruption efforts at the forefront of what our mission will be doing, including working with partners in civil society across Sri Lanka.
Thank you. Senator Barrasso.
Thanks so much, Mr. Chairman. Senator Shaheen, had you just come in? If you'd like to go first, that's fine.
Feel
free. Okay, thanks. I'd like to talk about the World Health Organization, if we could. The Biden administration has vowed to reform the World Health Organization, but it threw away its leverage early on, in my opinion.